Hey everybody, Charlie Hogwood with Survival Dispatch here tonight for a quick update on the coronavirus situation. So where we are today, we are in an official presidential disaster emergency declaration. So what does that mean to us? Well, that means that currently we've already had quite a few national and local sporting events that have been canceled or postponed. So the NBA, the NCAA, a number of different larger professional as well as collegiate and even school sporting events and mass gatherings have been shut down. So we're not going out to see any of those. Air travel from Europe and mainland China is, as of midnight Friday night, the air travel shut down, and China travel is still offline for now. Schools and universities nationwide have been announcing their shutdowns. Spring break is coming up, so there is some combination with just extending spring break for right now. It looks like most of the schools are looking at an initial 2 weeks, so we'll see what happens when they reevaluate that. And since the president had declared a national emergency, that frees up resources from the national stockpiles, which is going to assist the medical agencies, hospitals, and CDC, and even release FEMA and a lot of dollars to support the virus uh, reaction. So how we're going to attack that? Um, Drive-through testing has begun, and Google has set up or is in the process of trying to get a website up and running that will allow Americans to go online and enter in your symptoms. And if your symptoms call for it, then what'll happen is you'll get directed to the nearest drive-through or lab facility. And the reason that they're trying to do the drive-through lab, so it's an interesting concept. I believe South Korea has already done this. The reason for the drive-through labs is it keeps you in your car. It doesn't have you walking through an emergency room and then possibly infecting everybody else that's in the same room. So it's a new approach to things. It has come about after a very failed rollout of the testing system and a failed rollout of the entire message for how to deal with the coronavirus so far. So hopefully they're getting that turned around after the president had engaged private sector in addition to government sector agencies. Hopefully that we'll get this thing sorted out, because the rollout and telling everybody that it wasn't as bad as the flu has caused the message is now stuck with people. And in my daily travels, when I have conversations with them, even today, even while they're standing in lines, and I went out and ventured out myself in line today just to check it out and see what the food situation was. What a disaster. And people are like, well, I'm just going to stock up a little bit. I just wanted food for tonight. Uh, and when I ask them, and they're like, well, it's not as bad as the flu. And I said, well, you haven't been keeping up with the news, maybe. No, that's what I've heard. So once you give people that message, that's what's stuck in their head. It doesn't matter that the whole world is screeching to a halt. What they hear is, well, it's not as bad as the flu. And well, maybe it's not. Maybe it won't affect you. But that's where we are. So hopefully this mobile testing will help. The goal is to try to get these results out on the initial versions of this within 24 hours. Then they want to eventually move to more of an instant on-site swab that can give you more of an instant uh, declaration of whether you have it or not. That takes, according to the CDC doctors, about 6 to 8 weeks to really refine that so that it's dependable. So we'll see how that goes. Denver was rolling out their drive-through testing today, and apparently had a big backlog, and they ended up having to shut it down because it was so popular. So there are still some kinks and bugs to be worked out on that system. So it does turn out, we as Americans always have this feeling that our medical system is the best, our is the most effective, the most reactionary, and everything. And I think what I'm starting to see is maybe that is not totally the case. We've got other countries who seem to be really able to be a little bit more agile in reacting to this. And it turns out that our older pandemic uh, response was not designed for the mass casualty or the mass reactionary system that we're looking at now. It's odd. It's interesting. I don't know why that would be the case. The swine flu, we had a lot of cases, but they were more regional, and now we've got stuff that's spread out all over the globe, and it's not working. So I'm a little disappointed in the government reaction to some of this, but that's where we are on it. Hopefully, they're going to get that tightened up and turned around very quickly. So the goal right now is to what they say. If you may have heard this term, flattening the curve, and the reason that what that curve is there's a chart that was created, and it's basically what it shows is if we did nothing whatsoever for the virus to respond to it, we would have this straight up peak on the graph, and that peak surpasses what our national hospital bed capacity is. If we don't do anything, we'll have this massive peak cases, and it'll overwhelm the surge over the system will be so great that we will have a lot of unnecessary death and hospital beds that are being misallocated. You'd have to do something like Italy is going through right now, where they're actually trying to decide, does this patient live or does this patient live? And they're having to make those choices that, okay, well, this is a younger person. The older person, we don't have the resources for, so we're just going to have to let them pass peacefully into the night, if you will. So we don't want that. So when we say that the flu it's not as bad as the flu, what we're trying to say is, let's make a more organized response. Let's do a better job at containing the infection at your home level, at your community level, because if we don't, we're going to get this giant spike of patients, and it's going to trickle down through all elements of society. So it's not just that the older people get it or the immunocompromised people get it. It's that we're going to affect people across the entire medical spectrum. So that's where we are. So to flatten out that curve, the more we curb the response, or curb the virus as it infects other areas of our community, we're giving all of these health departments time. We're giving hospitals time to clear out the bed space, to increase the bed space, to get the tests online, to get all these surgeries and all these elective things rescheduled and dropped out, so that now we can free up that space. And now instead of the curve spiking, what we're doing is we're just doing this and trying to keep it below that hospital maximum surge capacity, where we're not looking at trying to get 6 people to the same bed, which is a number I've heard as I've done my research here. So that's what we're trying to do as far as flattening out the curve. So there's been a run on groceries and, well, especially toilet paper. If you've seen memes and everything that's going on social media and in the news, the run on groceries, maybe people are starting to take this into account and saying, hey, I might be home for a while. Let me get some extra groceries. All of that could have been avoided with a little bit of a food storage program. We've talked about that, but now here we are. We're maybe, doing a little bit of an I told you so to some of our neighbors. If you are, then, it's good for you. You've done that, but now we need to stick together and help each other out. So there has been a run on groceries. If you don't have food now for at least several weeks, I think that there's quite a possibility that you're going to come up short, or you're going to be stuck eating things that you don't don't want to buy or eat, from those stores. Now, here's the caveat. Here's the problem. If they do go ahead and do a nationwide shutdown, and if they do start shutting down grocery stores and places where you can buy your supplies, you can't run out and even buy the stuff that's left on the shelves, because those places will be closed. So none of this is fear mongering. This is just we're tracking and what's trending right now is everybody is running to the store. If you've seen Costco, Sam's, any of the grocery stores, they are slammed with people buying stuff, and it's starting to take on a life of its own. So at this point, what I'm going to say is, yes, the pandemic is an issue that we should be aware of, but we now need to start paying more attention to the resources that we need to get by. So the runs on stores. So if you're not stocked up to stay home for several weeks at this point, I'm afraid that you might be out of luck or getting very close to being out of luck for a lot of things. Just as masks and hand sanitizer disappeared weeks ago, now we're starting to see chicken. We're starting to see, all the different paper goods are pretty much gone. You're not going to get a lot of that stuff. So you might still get some canned goods. You might still get some of the stuff that people are like leaving until the last. But again, if they lock those doors, you're not going to get that either. So that could be an issue. So it's not just you. If it's extended family, grandma, grandpa, people that aren't stocking up, people that live in apartments that don't have the room, maybe they don't have the finances to pick up a little bit extra food, it might be a great idea for you to jump in on that and make an assist wherever you can. Supply chains are at this point still disrupted from China and offshore. So it's already having an effect on the manufacturing systems in the US. So a lot of American-made equipment is sourced from foreign materials. And that could be everything from rare earth metals and minerals to pre-assembled parts to whatever, even pharmaceuticals. So all of those things are not coming here right now. Some countries like India has even cut off exporting any of their pharmaceuticals. They want to keep them for themselves. And a lot of precursor drugs and materials come from China. So that's a bit of a thing. And, we're now also in a little bit of a spitting war with China because they're blaming us in some corners of the world that we sent the virus over there, and we're blaming them that their way of living has created this virus. So there's already been some threats that maybe they won't send us stuff even once this clears up. And that starts to gets my spidey sense up a little bit. I start worrying about, okay, this is not just a viral problem that we're going to come together as a planet and solve. We're starting to expose the trade cracks, the geopolitical, infighting that is happening between all these countries. So when those containers don't show up on those ships to our ports with the supplies that we need to fill in our manufacturing onshore, are you going to be able to go to the store? Are you going to be able to get your car fixed? Are you going to be able to get your wash machine fixed? Are you going to be able to, get your new phone, get your phone repaired, computer repairs? All of you just wouldn't believe the stuff I've looked into lately that comes onshore from other places. And it's not just masks, it's surgical masks. It's everything. So if we start getting into elevating this trade war to where they just say, well, we're not shipping you anything, that's going to be a bigger problem than not being able to buy toilet paper locally in our Costco. So combine those shortages of materials to include the pharmaceuticals, precursor drugs, chemicals, and of course the masks that that everybody now wants to have. That's going to be a problem. So with those looming manufacturing shortages, I strongly recommend. I mean, I know the government is saying, okay, have at least 3 weeks or so. I'm still telling my clients it's 3 months. If you buy the food and the stuff that you need, the medications and stuff if you can, at least that's the goal. Go for 3 months, because if something gets worse, we're not going to see a peak on this for another month or two. And if you've only got 2 weeks worth of supplies and we don't even peak for another month or two, where are you going to be? So let's start taking care of ourselves and our family and start getting very serious about how we're going to do this. So the virus is one thing, but the economic and manufacturing disruptions are what I'm really worrying about a little bit more so now. That's going to reverberate through our country for months. And in some cases, if you're out of a job and it affects your credit, you could be feeling the effects of this for years. So let's get on top of this as much as we can. Let's work together. As usual, I'm not going to drag this on any longer. This is Charlie with Survival Dispatch. Check us out at insider.survivaldispatch.com. Go to just survivaldispatch.com to our blog, and we even have a podcast. So you can find that on all of the podcast, Apple Podcasts, Spotify, all of the podcast locations. Look up Survival Dispatch. This will probably be on there as a number of our shows. Our videos are translated to podcasts as well. Our magazine is fantastic. We just released On the Move, which is all about movement. What happens if you thought you were going to stay in one place and now you have to evacuate? What do you take? How do you do it? How do you convoy? How do you communicate? So much information. It is absolutely incredible. I'm proud to be a part of it. So, and if you need anything else on the consulting side, I run readygoprep.com. I'm happy to assist or talk with you or do whatever you need help with on there. Check me out on that at readygoprep.com. And until next time, this is Charlie Hogwood with Survival Dispatch. I'm out.